It's going to be a very long answer, I'm afraid. You know, we like to think that we control our lives. We don't always do. Sometimes circumstances have a lot to do with it. And I think to a great extent, my entire life was shaped by events that happened when I was a little over 1 month old. There was this civil war in Spain that began shortly after I was born. My father was tagged as a person who was hostile to the new regime. He became a political prisoner. He survived for 2 years in a makeshift jail where many people were killed. He then was sent by the Red Cross Exchange to the other side of the Civil War, where he survived daily bombing raids by the German and Italian Air Force that were rehearsing for World War II. He then survived concentration camps in Europe, and he eventually resettled in Mexico, where I met him when I was about 10 years old. And so clearly in our interactions and our conversations, survival was a big topic. And it was clear to me very early on that physicians survived a lot better than other people. There were people in the same jail where he was who had patients who needed them because they were their physicians. They were sprung out very quickly. My father was a school teacher. Nobody needed a school teacher. So a physician had an advantage in survival. Then there was another thing. I had to make a very early career choice. I was one of those, I'm not going to say child prodigies, I'm going to say one of those persons a little bit ahead of contemporaries. I was reading and writing when I was 4. I began high school in Spain when I was 9. I eventually entered medical school at 16. But my decision to enter that medical school at 16 had to be made 2 years earlier to take the proper track in college that was required. Actually, the total training was the same 8 years as it is in the U.S. But in my case, it was 2 years of college and 6 of medical school instead of 4 and 4 like we do. So at the age of 14, I had to decide. I was then influenced by this background of survival. And I was also influenced by the fact that I knew what a physician did for a living, even at that early age. And I had no idea what you did if you were an engineer or a lawyer or something else. In retrospect, I'm very happy I did it. It's a wonderful career. I was lucky. The reasons maybe I'm not terribly proud about, but I'll give them to you. First of all, I like the glitter and glamour of the operating room. The clicking of the instruments, the bright lights, the quick resolution of the problem at hand. But to some extent, I was also influenced by dreams of fame and glory. You could ask anyone on the street when I was making this decision, who are the most famous surgeons in the world? And everybody would tell you, the Mayo brothers and Michael DeBakey and Denton Cooley. You couldn't go ask people on the street who's the most famous dermatologist. Nobody ever heard of those. And so I think there was a little bit of this issue of hopes of dream and glory, which of course never occurred, never took place. But again, in retrospect, I'm happy I did it. Surgery was a fascinating field. It was a good way to do what I did, because really what I did was not to become a surgeon. I was always a teacher, what both of my parents had been. My father was a teacher, my mother was a school teacher. Except that instead of teaching little kids how to read and write, I taught adults how to become physicians in medical school and how to become surgeons if they already were physicians. And I always saw my identity as a teacher who happened to be a surgeon instead of a surgeon who happened to be a teacher. But surgery, again, like medical school before, happen in retrospect to be a good choice. I keep being lucky. Being in the right place at the right time. I did my surgical training at the Mayo Clinic. I was there for 5 years. The Mayo Clinic had an agreement with the University of Minnesota so that residents at the Mayo Clinic could also pursue a PhD from the University of Minnesota by doing their clinical work at the Mayo Clinic and doing all of their academic work and exams and such at the University of Minnesota, which are nearby. We're talking about 80 miles away. When I was taking the last series of exams to get the PhD, by pure chance, I was assigned to a surgeon on the faculty of the University of Minnesota by the name of J. Bradley Aust, who had already been hired by the University of Texas to move to San Antonio to start a surgical program and a surgical department at this new medical school that was then under construction. He was looking for bilingual surgeons because he knew the environment here. He didn't need me right away. He needed me 2 years down the line, which was when I legally could come back to the U.S. after my training. I mean, it was all there. I kept in touch with him because at the end of the exam, he offered me a job. What a nice way to wrap up your training. Shortly after I left, for those 2 years of interval, I met the lovely lady who's still my wife today. After we got married, we both came to San Antonio. We interviewed, we looked at the place, we liked it, we accepted. And then we had a wonderful year. We already had the job for a year hence. And so my wife and I went to Europe, spent a whole year in Europe. We lived in Paris, we learned French, we drove all over the continent, and then we came to San Antonio, and the rest is history. It wasn't a challenge, it was an opportunity. It's a lot of fun to be in a new institution. You're not bound by traditions. Nobody will tell you we've always done it this way. We could do it any way we wanted, and we did. When I joined the faculty, there were about 75, maybe 80 of us, full-time faculty, the entire medical school. About a similar number of students in 3 classes. We all knew each other. We went to each other's homes. It was a big, happy family. I should say a small, happy family. I'm not knocking the medical school now. Obviously, an institution has to grow and get bigger and better, and we are a much, I think, more important and useful institution now than we were when I came. But it was a lot of fun to be here at that time. I think without question it was the relationship that I established and kept with my students all through that time. Both the medical students, actually mostly the medical students if you look at numbers, but also the surgical residents with whom I had a teaching role as well. But that relationship is what made it so much fun and ultimately so rewarding. It again revolves around students. If you ask someone, what is a medical school's job? What does that institution do? Everybody says there are 3 things. You're supposed to do research, you're supposed to provide medical care, and you're supposed to teach. In theory, all 3 have the same value. In reality, only 2 of them count. Research and patient care, because that's where the money is. And teaching is often given short shrift. Dr. Aust, who was my boss throughout all the time that I was here, always valued teaching. He always said that's what we are supposed to be doing. And he supported my career completely. And I went through my 30 years before I began the retirement process without publishing a single paper and without having a private practice without having an office where I saw patients whose fees could be used by the medical school. I did strictly the teaching of medical students, which obviously in my case had to include the practice of surgery, but it was the practice of surgery at the VA and at the county hospital. It was the practice of surgery that was not private practice that brought money. And Dr. Aust supported that from beginning to end. And I was able then to make a contribution that I think was valuable to the people that were involved. Dr. Aust. That's an easy answer. Dr. J. Bradley Aust. Well, he made it possible for me to do what I did best. I think I was a reasonably good surgeon. I didn't kill any more people than my colleagues did. And I suspect had I decided to pursue research, I could have done it. I had to do it for my PhD. And I did a reasonable piece of work that enabled me to get the degree. But if you try to be introspective and ask yourself, what do I do best? What do I do better than other people? In my case, it was clearly teaching. It was the joy of communicating information to other people and to watch them grow and develop, and that's what it is. Technologically, we can do a lot more now than we did when I began. The interpersonal relationship, though, has changed significantly, and I'm afraid not for the better. When I entered medical school, well, you already know that I'm an old person, so I will give you the year. It doesn't matter. 1953. When I entered medical school, you had made a decision in which you put your entire life at the service of the patients who would need you. And we were drilled in medical school every day. You're never going to get tired. You're never going to get sick. You're never going to get hungry. You're never going to be, sleepy because your patients need you. The patient's needs came first. And that meant that once you were a physician and once you were practicing, you were at the service of your patients 24 hours a day, 7 days a week. At the present time, in the training of physicians, there is now an artificially imposed limit of how many hours a trainee can be taking care of patients. In my field of surgery, that is really a very crucial issue. Because if I were to do surgery on you, I wouldn't want to do that, but if I did, if I were to do surgery on you on Monday, and on Friday you had a big complication, there isn't anyone who would be better equipped to operate on you again on Friday when you need it than me, because I was the one who operated you on Monday. And even though I might have written a very extensive operative note, I know more of what happened inside your belly than any other surgeon. But at the present time, under the rules of training of surgeons at the present time, they can only be so many hours per week involved in their training. And if those hours already pass when you have your complication, a different surgeon has to operate on you. The institution would be in big trouble if they let that other person do it. Well, this situation leads to a 9 to 5 Monday through Friday mentality on the part of the surgeons who are training now. There are no limitations that affect the practicing physician, but once they become practicing physicians, they have the mentality we gave them during the training. So that is something that I think we did better in the early years of the medical school than we do now. It's not our fault. This was imposed from the outside. But that's the only thing, that's the only element that I could criticize in terms of how things are different now from the way they used to be. Otherwise, we have a lot more to work with. We know a lot more. We have advanced tremendously. You know, the future is always better than the past. Don't you believe this thing about the good old times? They were not so good. You know, there was a valid reason why this began. There was a young lady in New York City who had an acute health problem. She went to an emergency room. The physician who saw her there had been on call for like 48 hours or something like that. And she eventually died. And of course, there was no need for that young lady to be treated by someone who was not fresh and rested. The problem is that was extended then to everyone, not simply a new patient arriving to be cared for the first time. It was then extended to the patients who already had been cared by a person who would have been the better person to take care of them again should the need arise. So it's not a blanket problem. I'm sure there are situations where these new, more humane type of training, in fact, might be appropriate. I think we made it into that elite group of the best medical schools in the nation. And I have to give credit for that to the administrators that we've been lucky to have. There are people who had vision, who were politically very adept, and to thrive in this environment, you have to know how to get the money and get the treatment that is favorable to the institution. I think we've been very lucky. We had excellent talent at the helm, and we've done very well. I don't know that I have advice for the faculty. I'm going to borrow advice for the students, and I'm going to borrow the advice from a former student who became eventually a faculty member and who was closely associated with me in the teaching of the surgical courses. This happened to be a young man who loved to fix noses, okay? He was in ENT, and he specialized in aligning a nose that wasn't working very well. And he used to tell our students, in emphasizing what a wonderful career, medicine was, and in telling them not to worry too much about the socioeconomic changes that people were talking about, the way you will have to practice medicine as opposed to the way the older generation did. And he would tell them, if somebody were to tell me today, from now on, you can only make $20,000 a year. Physicians are not going to be paid a ton of money anymore. But I was given a choice. You can be paid the $20,000 a year driving a garbage truck or fixing noses. He said, I would fix noses. And then he would tell the students, look, you're headed for a wonderful career. You're going to enjoy it no matter who pays you, how much they pay you, how much they don't pay you. This is an opportunity. This is a privilege. This is an interaction that you're going to have with other people that will be gratifying no matter what. Go ahead and pursue it and go ahead and enjoy it. You're going to have a wonderful future. And I could tell that to the students or whoever might be looking at this tape in the future. If you are involved in medicine, hey, you're headed for a wonderful career. Well, I would hope that it would be an incentive or a reminder to administrators in the future that it's worthwhile to support the teaching function of the institution and to give it the same value that we give to research, that we give to patient care, that we give to the growth of the institution and so on. I would hope that that little bit would be there. Let me extend the topic of how lucky I've been. I began by being lucky because of the survival of my father and all that. Most people make the two most important decisions in their life when they are pretty young. Who do you marry and what career you choose? In my case, the choices were superb. I'm still married to that same lovely, by the way, she was a medical student when I met her. That beautiful, lovely senior medical student that I met in Mexico City, with whom then I came to San Antonio to look at the job, etc. She's still my wife. She's wonderful, and I couldn't have done any better. And I already told you how good medicine turned out to be as a career, and even better, the opportunity to be a teacher that produced physicians. A few people have a third opportunity. I was one of those. To choose the country where you're going to live, to choose the nationality you prefer to have. And in coming to the U.S., I couldn't have done any better either. I'm sure there were other advanced Western countries where people can do well and have a very gratifying career. Many of those, though, are not open to immigrants. Many of those, if you're not born a Japanese, it'll be very difficult for you to become a Japanese. If you're not born a Norwegian or a Swede, it's unlikely you become one. But the US of A is this wonderful place made up of people who came from all over, some of them many generations ago. That's why some of you were born here. But, this is that melting pot we keep talking about. And to be a part of that was another blessing that I had.